My son became a drug addict. We didn't notice it because while I was busy with trading, I didn't pay attention to my child. And now I am in grief. I wouldn't wish it to anyone, even to an enemy. I want to say, take care of your children. Drug use is one of the top 20 risk factors to health worldwide. About 240 million people used illicit substances at least once in 2011. About 27 million people of them use illicit substances on a regular basis. Prevention of drug use plays a significant role in bringing up harmonically developed generation. Within the framework of the global project Prevention of Drug Use, HIV/AIDS and Crime among Young People through Family Skills Training Programs in low and middle-income countries, the United Nations Office on Drugs and Crime implements family skills training programs as one of the most effective approaches to prevention of risky behavior, including abuse of psychoactive substances. Healthy environment in family plays a very important role in development of children and youth. In particular, it is clear from research that competent parenting is a powerful protective factor from many different risky behaviors, including substance abuse and delinquency. As a result of a rigorous review of existing evidence-based family skills training programs, UNODC has selected Families and School Together FAST program to be implemented through the global project in Central Asia. Main goals of the program are: strengthen the family and the parent-child bond, increase the child's success at school, reduce drug and alcohol abuse in the family, reduce stress in the family and isolation from society. This evidence-based family skills training program is being successfully implemented in pilot schools of Central Asia since 2010. Families and Schools Together is an after-school, universal, interactive multi-family group program offered for 8 weeks to all children within the same grade and their families. It builds relationships between parents and children, parents and school, as well as parents and other parents within the local community.
One of the things that's also been wonderful about Central Asia is that in every single country there is been developed a sustainability model. We've trained national trainers in every single Central Asian country who are very high quality, very committed to developing the evidence-based programme throughout every Central Asian country. They work hard, they're diligent, they love the programme and they're committed to working with parents and their children. The programme itself is also developing school and learning readiness in their children so that when they actually are in school, they're ready, they're receptive to learning. By having parents and teachers working together to support children, it enables them to learn more effectively. It's a combined approach, and this combined approach is working in Central Asia. It's a very wonderful experience.
Благодаря фасту мы научились.
Through the fast, we have learned to know the inner world of our child, emotions, feelings, and experiences through these drawings, through the games. We started to better understand our child. Fast, it rallies together families because grandfathers, grandmothers, mothers, fathers, sisters and brothers can participate in it. It is a very great work to strengthen families. Families and schools together makes a huge deal, brings families and school close to each other. Children became closer to each other too. It is a great work done. In our country, family, mahalla and educational establishment are three branches that ensure life-sustaining activities of a pupil. From this point of view, Family Skills Training Program enriched with a new meaning our system of public education. This training is aimed at preventing pupils from bad habits, which lead to the negative results when parents and teachers leave them without attention. During the sessions, parents along with the community develop in pupils immunity against risk factors. I think that organizers didn't make a mistake by choosing our school for implementation of the Families and Schools Together program. This program is suitable for our region, where families with many children live. At the beginning, parents did not believe that they can learn anything useful, but after the first sessions of the program, they started bringing with them other children as well. It is a great pleasure to see that parents who participated in this project finally turned towards the school. And if this program is going to be continued, it will be a great support for any school, because the community should be involved in the school's life and activities. The program is held once a week during 8 weeks. Each session includes different evidence-based interactive components, such as fast hello, family meal, making family flag, music and fast song, feeling charades, scribbles, body time, parent group hour, kids time, special play, lottery, closing circle and rain exercise. During the fifth session, a specialist on substance abuse is invited to inform parents on drug use and its prevention. As a teacher, I felt that FAST program helped to get closer to school children and their parents. We're already in a 2-year partnership which gave the results. Our class became not only united, but we also have great achievements. The pupils of our class won international, national and regional competitions. Also, our class was awarded as the best class in 2012 among 43 other classes of our school. I think that FAST helped us to achieve it. I have a little daughter, and most of my attention was given to this younger child. I thought that my son is already grown up and there is no need to pay a lot of attention to him, because he can manage his daily life on his own. When I started to participate in FAST, I realized that I gave a very little of my love and attention to my son. I was worried about that and felt that my life went the wrong way. Now I am trying to fix it. The 8th session is special. It is a graduation day for families of the program. They prepare performances, sing songs, dance and share their impressions on the Family Skills Training Program. Having held 8 sessions with our families, I understood how important it is. Children rallied, they became closer and more friendly with parents. The most interestingly is that not only children became open, they could tell anything, share their impressions, but also parents learned to share impressions, emotions with the children and with other parents. In other words, they rallied among themselves very strongly.
FAST supports parents in shaping the moral life of the family, in the prevention and diagnosis of addiction and prevention of negative manifestation of children and adolescents. An effective cooperation between families and schools played great role in pupils' education and personal formation, and FAST gives such opportunity.
During the program implementation in the region, international experts trained 260 local trainers, 12 of whom received the status of national trainers, what gives them an opportunity to introduce the family skills training program in any site of the country. About 700 families benefited from the program in 5 countries of Central Asia. When there was no FAST program, I wasn't able to talk to parents, and now I can talk to them, help friends, help younger children. We made new friends, we danced, there were many celebrations, it was interesting. Active involvement of the departments of public education and the community attracted us in the program. We established a cultural adaptation group, which monitored the program implementation in schools of Tashkent city. And we were convinced that the FAST program strengthened families and parent-child bond, improved academic performance of children at school. Based on the positive results of the program, we would like to introduce this project to the system of public education of Uzbekistan. Results of evaluation of the program's effectiveness in Central Asia demonstrate significant improvement in parent-child bond, decrease in family conflicts, increase in parent involvement at school, improvement in children's behavior at school and at home, increase in parent social support, and decrease in alcohol and tobacco use in family.